Alright, so that procedure of RPHG is very necessary. Although you would have extraction decision in the second phase, but this one cannot miss out because the middle phase will be getting a bit of fullness, a bit of change with RPHG. Yes. So with RPHG, we almost do not do any the individual teeth movement. Just hold the patient in such position, make sure that X16 will be working. Okay, good. All right. The second phase of the stage 1 is that we have extraction. Sometimes the dentition to dentition stage is that either non-extraction or extraction. Right? But in the class 3, the class 3 case of extraction, possibility of extraction much more than class 2. Okay? Yeah. And we have a dentition to dentition. Now, we finish. Very dangerous actually. The mandibles keeps growing. Still, the mandible is triangle and we're quite deep. But although it still keep growing, that is quite because the dentition is being matched with extraction. So it's quite safe. The possibility of the second stage is very slim again, okay? Yeah. What? Alright. So stage 2 may not occur because we have already extracted teeth. If I extract teeth and still have a second stage, it's very tragic. It's tragedy. Okay? You have to make sure that after the extraction of teeth, there's no possibility of the relapse. Right? Okay. Alright, deep curve again. Okay. 15 years of age is the end of the second age range for the first visit. Right? Okay. There's some deviation anyway. There was partial cross-bite, and that cross-bite doesn't matter. What matters is its nature. Is skeletal or positional? Okay? By looking to the morphology of the mandible, okay, right? This simulation, okay? Good. Do you think it's dangerous or not? Triangle, deep, very, very dangerous. Okay? But the good thing is that the age reached to the end of the second age, 15. 15 is already the one that the growth third is already finalized. So relatively it's still safe. So the philosophy is that the later the patient comes to the office, the safer. The earlier the patient comes to the office, the riskier. Right? Okay. Because that patient has reached to the 15 years age, so the second stage is the second stage, because the stage is very remote. Okay? Say it again. Now, that's 10, 11, 16. That is a very good combination. Okay? 10 to move the mandible, to reverse the mandible transversely and backward. Okay? 11 makes some expansion, and also 16. We still use orthopedics at this age range. Okay? Good. It's very good. We have a S10 plus sometimes. You have to use that. Because the other, like a line or something doesn't work for the reposition mandible. S10 is very useful, especially for deviation of mandible. Alright? We hold the mandible in the right position. Under this position, you have the tooth or dentition to dentition. Alright? S11, take a look. S11 has appeared for the initial period, and after that we remove it. And we have a gradual reduction of the thickness of the glue plane. Right? Means that we are doing the curve speed flattening, and also the problem relief. Most important thing is that mandible is reshifted to the right position. The middle line, dental middle line, finally should be on. Right? Okay. Take a look. Initial phase 1 finish. Now phase 2 is what? To have an intercostal relationship deliberation. That's much easier. Midline is already on. Take a look at the midline. Check how the midline is very off, right? And now midline is on. Okay. So restoration of the position manifold is so critical. You can't just put the brace on, put the routine alignment on, hoping to have a correction of the mandibular position by elastics. Elastics doesn't work. Okay? Elastics doesn't work. You have to make the whole mandible in the right position. Under that position, you could have some additional correction. Okay? Always 3 lines. Red line is facial midline. Yellow line is upper dental midline. Blue is lower dental midline. They are not necessarily overlapping together, right? The final result should be there's 1 line. Right? This second stage is much easier. We finish. Almost in the same line, okay? Overlapping in the same line, okay? And this is the occlusal. Take a look. And we change with the facial appearance, of course. And then we have facial appearance. That would be very important from front of view. If the deviation mandible is very obvious, patient will be not happy with that. And then after correction, okay, the deviation of mandible is much improved. Almost on. The chain is almost overlapping with facial midline. Okay? Although it's triangle with a D, but patient getting into the 15 years of age, the danger of relapse is getting decreased. Okay? All right. Take a look. It's very the dentitional one, the low incisal compensation is great. Just like they are, the position is just for the so that we have to upright the low dentition. Okay? 2 years of follow, always very stable. 90 years of age. Do you think he's still have a risk of relapse? No. 90 years of age. Good case, right? All right, okay, so 11 and 15 years of age is the patient that we have, most of the patients will fall into that age, okay? See? 11 years of age again, take a look. The facial appearance is not very severe, but don't overlook, you must be very cautious, okay? Although the facial appearance is not obvious, take a look. The crosswise is very shallow, and initial, what did you see? It's triangle with what? Deep curve. The point, the chin point is in this direction. 11 years of age, in the very initial age stage, is high possibility of relapse. Okay? And then falling to the spittle. Now we have the stage 1 of 2 cases again. One is orthopedics, followed by what? The orthodontics, okay? And stage 2 may occur. Why? Because the age is very young, and also the curvature is very deep. You have to tell the patient beforehand the strong likelihood of the relapse. Okay? We have orthopedics. And we have orthodontics, and we finish. Look like quite optimistically it's quite good, but we never say anything optimistic because underlying morphology mandible is really not good. Okay, So you have to tell the patient that a high possibility nurse. With the passage of age, with the time, the depth of the curvature is getting deeper. Right? Take a look, initial, and we're finished. Okay? This. Dangerous. This area is going forward. Allowing the mandible grow as much as it can allow, right? Pick up, relapse. Take a look. Take a look. We finish and we relapse. But the good thing is that we already told the patient about the relapse possibility before we start the treatment of the patient. We told the patient that the likelihood of relapse will be happening in the 15-year stage. Nice? See, it's true. And patient will not be very nervous, and you will not be surprised if the patient appears in your clinic again. Okay? You also need to charge. Right? Relapse. 15-year stage. So, what we do? We have root treatment. This is stage 2. Right? We have root treatment, and we finally finish the treatment. Alright? So that's what we have. There's no possibility, there's no possibility to have coverage of the whole the length of the conduct. Alright? Getting longer, take a look. Getting bigger. So rule number 1. At the very first day you see the patient, you must have assessment for mandible morphology, not just measure the angular and linear measurements. That's the work. SMA, SAPA, BY, lots of them, like 100 data, give you no information, right? Morphology does. Okay? Morphology does. How big it is, how tall it is. Now the depth, the deeper of the curves, the synthesis, the taller of the patient is proportional. Yes? And also proportional with the length. So you take a look at OBG, you can predict how tall the patient will get. Right? The very first day you saw the patient is a small guy, small boy. But all of a sudden, 1.940. It's like, right? That's for more athletes. All right. 30 years of age. Facial appearance is not severe. Take a look. Triangle, deep curve, right? Be cautious, okay? Be cautious. You can start treatment, but you have to tell a patient that it's a possibility that you could have ended up with that one again. Okay? As long as the depth of the synthesis is deep, it indicates as long as the genetic nature allows, the mandible will be growing such that there's no limitation. Sometimes the relapse, the treatment have to be resolved to surgery. So we always tell the patient the possibility of a surgical intervention as long as the morphology of the mandible is triangle together with deep curves, the deep synthesis. Otherwise, but it's still necessary to have early treatment, right? Because if you finally still need surgery, the surgical modality is much simpler than if you did not have any intervention. You have to tell that, right? This is a lesson, okay? So don't never say promise the parents about the correction of the class 3 patients. the picture will be taller, like